Okay.
Total 3 slides, okay?
Okay. Yes, ma'am. Next page. Okay. Next.
Starting your 10 minutes time.
Okay. Hello, I'm Dr. Taskeen, one of the doctors here today. Can I just confirm your name and age, please?
Yeah, I'm Bola. Adi, okay.
Okay. Adiko, how can I address you?
Yeah, Bola is fine.
Okay. Bula, I can understand that you're here today to discuss about your result report. Am I right?
Yes.
Okay. Is your partner John attending today? I can see that you're alone today. Is he coming to join us?
He's busy.
Okay, that's fine. Adiko, do you have any other concerns or expectations today?
Doctor, actually, I have been tried since last 3 years, and it is taking me long time. And you people are just keeping on waiting me, asking me repeated investigation. So I'm really fed up. I want to fasten this. I wanted to get pregnant as early as possible. I'm
I
already
can.
50.
Yeah, I can understand, Ediko. I'm so sorry for the situation you're going through. Definitely, you'll address your concerns and discuss your reports in a bit of time. Before that, it's okay if I ask you a few questions, as I want to apologize you, as your notes are not here today. So I want to ask you something so I can know you better.
Okay.
Okay. Ediko, can you tell me what treatment, any treatment you have tried so far?
No, doctor. Actually, me and my partner are together since last 4 years, and since last 3 years, we are planning actively without
Okay.
any contraceptions regularly. But it's not getting any positive news.
Okay. And
So
can you,
that's the
yeah.
reason I'm seeing a gynec. The last time when I visited 3 months back, the consultant has advised to do all these investigations, and waiting too long is making me frustrated, doctor.
Yeah, I can understand. It's quite a valid concern. Atiko, can you tell me more about your periods?
Yeah, they are pretty irregular. They are actually 28 to 35, sometimes 40, 45 days also. And that is
Yeah,
what I'm getting.
when was your last menstrual period?
It was 2 weeks back.
Okay, 2 weeks back. Do you have any history like of excessive hair growth?
Not excessive hair growth, but I do get oily skin and lots of acne.
Okay. Okay, and you experiencing any excessive weight gain?
My weight is little on a higher side. My weight is 86 and my BMI is 30.
Okay. And can I ask you a few intrusive questions that are important for management?
Yeah, that's okay.
Okay, how's your sexual life? Any problem with that?
No, doctor. Actually, rest of the time we do have occasional sex, but around the time of ovulation, I do have
Okay,
regular sex 2 to 3 times a week actually.
okay. And as your is your partner fit and healthy?
Oh yeah, he's quite fit and healthy.
Any problem with the erection or ejaculation?
No, no,
Okay, and are you updated with your smears?
yes,
Okay, how you or your partner, parented a child before?
never.
Okay, and do you have any medical history of concern?
Mm, As of now, no.
Okay, any drugs you are taking?
No, doctor, not yet.
Okay, any known allergies?
Yeah, I do have allergy to penicillin, so I avoid it.
Okay, I'll note it down. And do you have any history of surgeries in the past, like any surgery in the tummy or down below?
No,
Are you aware of your weight to height ratio?
I told you it is 30.
30. Okay, and do you smoke?
Yeah, I do smoke 10 to 12 cigarettes a day.
Okay, what about alcohol?
Occasionally, I do take wine.
Okay. Any recreational drugs?
No,
Okay. And do you have any family history of concern, like similar history in any sibling or parent?
no,
Like,
my mother and father they are staying in African countries. My mother is a fit person, although she's heavy. My father is a diabetic and hypertensive.
okay. And do you how's your support at home, at the cook?
I do stay with my boyfriend, and yeah, he's well supporting me.
Okay. Yeah, thanks for sharing this information. Do you want anything else to add?
No, thank you, doctor.
Yeah, Atiko, if with your consent, can I just examine you in the presence of chaperone?
Oh yeah,
Okay, thank you. Atiko, now we're going to discuss about your reports. For discussing your partner's report, I need his consent. Has he given you some permissible consent?
yes.
Okay, that's fine. Atiko, I have just confirmed your name and NHS number on your reports, and they belong to you. Adi Cook, regarding your some blood tests were done for you, and I'm afraid to say that I have a little concerning news for you.
Okay,
Okay, the tests were done to know about whether you are producing the eggs or not. That's the ovulation test, and that is showing that the eggs are not, produced from your egg basket or the ovary. Okay, rest of the blood tests, that's some hormonal tests, they are normal. Okay, and one of the tests, that's the prolactin, which is one of the proteins in our blood, that is showing to be on a higher side. Ediko, can I ask you, do you have any history of like breast discharge?
oh yeah, I have recently noticed I do have a breast discharge.
Okay, okay. And okay, that's now coming to your husband's sport. I want to ask you a little one. Do you know about your what's your husband a partner doing?
Oh yeah, he's a teacher, school teacher.
Okay, does he have any medical illness?
Oh, he's absolutely fit and healthy.
Okay, that's fine. Any social habits like smoking,
No,
alcohol?
no, no.
Okay, okay. Ediko, I also confirmed his name and NHS number on his report, and they show that his report of sperm analysis, that's quite normal. So, Eddie according to reports, the one of the causes, we have seen that there is, the hormonal test which shows that the eggs are not producing. So, this might be the reason for the delay in conceiving. Am I clear to you?
Okay. And why
Yeah.
these eggs are not releasing, doctor? Any particular reason for that?
Yeah, Eddie from your history, I can make it out. And one of the most important, most common causes of this failure to ovulate it's a PCOS. Have you ever heard of this condition before?
What, doctor? I didn't get it.
Okay, from your history and from your one of the most common reason for this like failure to ovulation is the condition called as polycystic ovarian disease. Have you ever heard of this before?
Yes, I have read about it.
Yeah,
So is it polycystic ovarian disease, doctor?
yeah. For that, we may need to run some more tests, but as per your clinical scenario and as per your like for that we may need to run a scan also so as to clearly make it out.
Again, I have
Okay.
to wait, doctor. Again, I have to do a more test. I'm really frustrated by doing all these things and not getting proper treatment.
I'm so sorry, Ediko. I can understand your frustration. I know it's a very distressing condition for you. However, we want to reach to a conclusion so that we can treat you better and to have a proper treatment for you. Okay. And
Okay.
a second reason can be the this and another test, which is the increased prolactin level. It can also lead to an ovulation, but for that we may need to repeat this test in some time because to be much sure about that it's the cause of an ovulation for failure to ovulation. Okay.
Okay.
Also, Ediko, relating to your simple life, like for this combating this problem, I would like to suggest to you some lifestyle measures because a small change in your lifestyle can make a large difference in your symptoms and ability to conceive. As I can see that your weight to height ratio is slightly on the higher side. So if you are, it's okay with you if I connect you to some dietitian and the exercise doctor, so that we may cut it down a little, which will increase the chance of your spontaneous conception. Is that okay for you, Etiko?
Okay.
Yeah, and also one of the factors like the smoking, this is a known cause for delay in the conception. So if you want, I can connect you to NHS Stop Smoking Services, so as to increase the
I'm
chances
giving
of.
you extra 2 minutes because we have completed your 10 minutes time. I am giving you extra 2 minutes. Okay.
Okay,
Start.
okay,
Yeah.
yeah.
Going
So
very nice. Going very nice. We need to work on time. Okay. Started. Continue.
okay. We need to connect you to NHS Stop Smoking Services, which will help our drugs to act as well as increase your chances. Is that okay, Ediko?
Oh, yeah.
Yeah.
Yeah, doctor.
So for the time, we'll arrange a scan for you as well as the repeat serum prolactin levels. Do you want to hear about the treatment options which will be available to us
Yeah.
in? Yeah,
Yeah, I will be happy to hear about it after
yeah.
that.
One, yeah, we have got medical and the surgical options. The medical option is the use of a drug we call as a clomiphene citrate. So what it does, it helps in the release of the eggs. It has to be taken for 6 months. And before that, we need to confirm. I'm sorry to say that before that, we need to confirm the patency of your fallopian tubes. Okay, by again another test which is called HSG, oral keyhole surgery. Okay,
Okay.
yeah. And after that, once it is confirmed, we can give you this medicine. It has to be taken for 5 days in a cycle, and it can be taken for 6 months. During this treatment, we'll monitor you by a scan to know whether the eggs are being, produced in the ovary or not. Okay.
Okay.
It has got some side effects, like there can be sometimes, multiple. There are chances of having more than one pregnancy, which we call as a multiple pregnancy, like twins, or some vision problems. However, it occurs in few patients. And the cook, if it doesn't work, then we will see whether there's ovulation or not. If the eggs are not getting released, that means it's not working, it's resistant. We may go for a surgical option, that is the laparoscopic ovarian drilling, and it's a keyhole surgery. Okay. However, if the eggs are released, however, and you are not conceiving, we can connect you to again a fertility specialist for the assisted fertility techniques. Okay. And
Okay.
I know this is a very disturbing situation for you, and you are really worried. I'll connect you to some support groups and the counselors which might help you in relieving your stress. And I'll also fix your appointment with my consultant and the fertility specialist. Is that okay for you?
Oh, yeah, that's good, doctor. Thank you.
Do you have any further, yeah, questions? Thank
Oh, thank you. Okay, so tasking, apart from time, it was
you.
wonderful to listen to you. It was a very easy consultation when it comes to dealing a fertility patient. Okay, so you need to work on your time.
Time is a problem.
Yeah.
See, we talk and talk and mm,
Yeah, so you need to see where you can minimize, how you can minimize your time history taking, because your history taking was 5 minutes 15 seconds.
oh, that was a long, yeah.
Okay.
Okay, ma'am. Yes, got it.
Okay, so apart from that, it was wonderful to listen to you. Okay, and I think others will also accept that. Yes or no? Only few points which has been missed here and there, but
Okay.
okay, yeah, okay. I will not miss. It will not be. Yes, Dr. Manika, ma'am. Yeah, she was very good, very smooth, and it was a very good communication with her patients where the patient was distressed, frustrated because of waiting, because of having a repeated investigation. So this was really very nice conversation. Okay, just
Mhm.
wait. Okay, now only few points here and there you had been missed out. One is STI history because we need to assess a tube
Yeah.
test. Okay, one point
Yes.
which I find, although the book has mentioned she should be going for a tube test prior to starting a HS, this ovulation induction.
Yeah.
But what NICE is saying, anybody can comment on that? Anybody? This is an interactive session, so everybody is having equal chance to participate,
Yes,
even
ma'am.
if they are not present.
I do remember another mentor told if you do if you offer clomipene without tube testing, it is
Mm.
very unethical. Like that, one madam told.
No, but what
Mm.
is NICE saying? In NICE, actually, they give 3 cycles, and if they doesn't conceive after 3 cycles, then we will. I will try to search on this because the book has mentioned that do tube test and then go for ovulation studies. Okay, ovulation induction.
Yeah, ma'am.
But
I have also
anybody.
gone through the strategy video about this PCOS and infertility.
Hmm.
And they also they recommend this tubal test to be done. This was the same patient, frustrated, and she was just getting angry and angry while offering me tests. However, she told it is not, it will not be. We're putting you to our medicines, so it's better that we know about the status. So they also recommend tubal patency, but we'll check the nice, ma'am. Yeah.
Yeah, because I feel the NICE is saying if no risk factor for tubal, means looking at her history, STI history is that's the reason STI history is very important. Pelvic infection, pelvic pain, basically not pain, STI, any surgery, tubal surgery, any previous contraception. So this three history would have given her any history which is related to tubal history. So I will recheck again, means that is my homework also, others' homework also. Please do check it because according to the NICE, I do remember that 3 cycles of ovulation induction if there is no signs of any tubal disease. Okay, but okay, we will listen. And if the stat OG video is of this way, then we should follow
Yeah.
the same pattern. Then there isn't any question. Okay,
Yes,
that
ma'am.
is
I will
one thing.
listen.
Yeah, then that is one thing. STI, that's the reason you missed out on STI history. Uh,
Mhm.
breast discharge and headache history was missed out, but you very nicely picked it up when you are noticed that the prolactin is raised. Okay. Uh, HSG keyhole or sir. Okay. So most of the points was up to the mark and they were quite bang on time. I do not say that there was any deviation in my answer sheet or anything else was there, but still we will go through it. Okay. Time management is one thing what we have to work. Okay. So see to
Yes,
it how
ma'am.
you will be managing it. So in the first part actually was introduction. Here only the situational awareness is that the missing case notes. Okay. Now identifying missing case notes, you have to say that we will avoid this kind of situation, and for that we will be needing to report it to the risk management team. See,
Okay.
Yeah, they do not take it lightly, missing case notes. Okay, if it is repeatedly, or we to avoid it, we need to
It
see.
will be, it will be
Yeah,
incident report, ma'am.
yeah, missing case details, at least not incident report, but at least will be, you have to look into the matter why it has been missed. Okay, I will not say that incident reporting per se, but we'll need to involve the concerned personnel and inform or escalate or report. At least say these words.
Okay.
Incident reporting, no, but escalate and report. Okay.
Okay, we'll report to the authorities
Yeah,
regarding
report to the
that, you know.
authorities. Yeah,
Yeah.
that one per sentence is very okay. The name is discussing report, setting agenda. Concern because I had already wasted time and nothing has been started. So here, yes, we do acknowledge that you are very frustrated, but we need to find out a exact reason why you are not getting pregnant. Then we can manage you accordingly. So that sentence will be very sure shot if you can say, even though you had given me some reassuring points, some reassuring sentences, but see why the delay is there. It is not unnecessarily we are not making delay. We wanted to know what is the exact reason why you are not getting pregnant. Then only we will able to manage the situation in a better way. So this is actually the concern. Assess the task. This is communication, pure communication task. Signposting in the beginning, because you know that we are anyway going to ask sexual history, anything here or in the beginning or at the time of sexual history. Since open question, whatever information I was having, I had given it to you. So it is straight question. STI history you missed out. Dyspareunia also you can ask. Dyspareunia, I think you had asked me. Okay, you had asked me. Menstrual history also you asked me. If at any time, if it is more than 4 weeks, offer offer UPT. Obstetric history for both. Okay, have you ever do, or your you or your partner is having any pregnancy, or wherever you were pregnant, or you had any kids from previous relationship. Okay, any of you. Then the history of differential diagnosis, because excess hair growth you asked me, weight gain, weight loss not you asked, but weight gain you asked me, eyesight, breast discharge, and headache is related to prolactin. High BMI, what have you ever tried losing? Okay, have you ever tried losing it? Because I said na that I'm having high. Yeah, I'm taking a walk. Appreciate at that point if she says, "Oh, please continue that." But you need to work on more and lose more pounds. For that, I will be referring you to a dietitian, and exercise regimen will be weight management clinic or exercise regimen. We will chalk it for you. Um, so offer community weight loss program and dietitian reference if BMI comes up, because you may not remember at that time. Here you can offer, or in the lifestyle, anywhere you can offer. Medical, surgical, allergy, you acknowledged my allergy, you documented it. Smear, smoking, alcohol, occupational, and partner history, few details only. Family history, you asked me. Medical and allergy, this is repeat history. Okay, so the history was complete. The point which you missed out here, dear, checking my background knowledge, whether I am aware about the reports. It is very, very important whether I am as someone discuss the report with me, whether it is BBN or whether it is a simple report. So that is checking my background knowledge, what I know. Okay, as you checked with PCOS, so here also you need to check. Then you asked me regarding husband consent, and you discussed his report. You explained me that the prolactin is little high, so it is not a chemical. What do you mention? It is hormone, na dear? What you mentioned? Blood protein. You mentioned blood protein.
Protein.
Yeah. So say protein, not protein. It's a hormone secreted by brain, and that could be the reason for breast discharge. So we are going to repeat it after 4 weeks. Meanwhile, if it is raised, we will be referring you to a, whom you are going to refer?
Hormone doctor.
Yeah, endocrinologist. Okay, for further treatment. Then now diagnosis. So why you are not getting pregnant? It is basically you are not releasing a egg. The
Okay.
prolactin, or the serum progesterone which has been taken is not, it's showing that you are not releasing a egg, and that is a reason. Now why you are not releasing a egg? Either it could be because of PCOS, but to confirm a diagnosis of PCOS, we need, yes, you rightly said that we need to confirm it by ultrasonography.
Yeah, because
As
only
there
one
are,
side
yeah,
can.
only one symptom is there, and there is no excess, means no signs of excess male hormones. If I wanted to say, why I cannot label it PCOS straight away, because like excess hair growth or excess facial hair growth, so no other signs of excess male hormone presence. I need to confirm it by doing a ultrasonography. I will be offering you a USG. Yes, so correctly you had identified. Now PCOS, did you wanted to discuss? Yes, I heard about it. Yes. So whatever points you can say. So PCOS is a reason for anovulatory subfertility. Uh, since her cycles are irregular, we can still repeat her progesterone weekly for till she gets menses. That also day 21 she may not ovulate in her case. Hmm? Now reassurance, basically what we are going to do, reassurance. Okay, so Bola, Mrs. Bola, do not worry. PCOS is a treatable it's means we can manage PCOS, and we can manage infertility associated with PCOS. So the options are lifestyle measures firstly, secondly medications, and thirdly surgery, and last option is IVF. In the beginning only, if you can say all those four, because when you are communicating with the patient and you know that you may have a less time, at least the examiner know that you had told her all the options. Hmm? Because what had happened in our conversation, we go systematically, stepwise. But then there was a time lag issue. So to avoid this, because we know everybody is having a knowledge, to avoid this thing, we can take a help of in the beginning only lifestyle, medical, surgical, and the last is IVF. So we will go step by step. So what now? Weight management. Okay, very important. And it will be associated with spontaneous ovulation if we will lose enough pounds, and spontaneous conception also. Quit smoking, very important, which you had addressed. Then we will offering you medications to induce ovulation. So drug of choice is CC, safe. Headache, nausea, vomiting, these are the side effects, but adverse effects are ovulation, sorry, OHSS, that is ovarian hyperstimulation syndrome, and multiple birth. So these are the side effects associated with this medication. 50 milligram day 2 to day 6. 50% of the time, within 6 cycles, most of the women get pregnant with this medication. Yes or no? Yeah. So now
Yes,
here
ma'am.
here I had mentioned about this tube test because I was not convinced, or maybe because I didn't get a time to read about NICE guideline. So we may change it accordingly only. So before that, tube test. Huh? Before that, tube test is important because we need to find out whether your tubes are working or not. What is the best possible tube test in your care, since there is no risk factor associated with tubal damage or tubal factor? HSG will be recommended in your case. It is safer also. Mm? So that is what we can offer her here. Uh, if with ovulation induction, if she fails to ovulate or get pregnant, then alternative medications like metformin, GnRH analogs will be added to you after discussing with the consultant and the fertility specialist. If doesn't work, then there is an option of surgery, which will be discussed with you eventually, because we do not have that much time. So it's, and the last resort will be IVF. Regarding funding, if criteria met at that time, the the criteria for funding will be discussed. Smoking cessation and having a healthy weight, these are the few of the criteria which a person needs to have to meet the criteria. Here again, you can emphasize why it is important to quit smoking. If you are having time, you can say about long term implication, but actually it was not there in the this answer key. Okay, it was not there in this answer key, but PCOS is PCOS, this is a means lifestyle disorder and can be managed only with a healthy lifestyle, healthy eating habit. If not managed, it will be having a long term implications like difficulty in losing weight, hypertension, high blood pressure, diabetes, cancer, prone for depression, bleeding, heavy bleeding leading to cancer womb. So this kind of diseases can be managed effectively by lifestyle. So means I will see to it that we will not have a further delay in the treatment. I will report your case details to the risk management team, whatever whosoever. Counselor is very important throughout this journey. And now you are going to write back to the GP documenting her care. So close the loop. Whenever I say close the loop, the 4 or 5 points will be documenting your case detail, uh, documenting in your case notes. It is not a GP letter here, involving the consultant fertility specialist, and arranging the serum prolactin, tube test, TVS, and we'll be seeing you after that. So meanwhile, Verity is a support group. Have you heard about this name? Yes or no?
Very
Yeah, so Verity is a support group. In cases like PCOS, they expect you to know the support group, because PCOS is very common in UK. Okay, and you can close the loop by documenting and sharing a support group and patient information leaflet about PCOS. So patient safety here is confirm patient's identity at the start of the task. You were switching. Sometimes you said Bola and then you said Adioke. So yeah, you decide what kind of communication you want. Okay, so that there should not be confusion. That is the only issue. Otherwise, it was very good. Demonstrate an understanding of the process and procedure to keep individual patients safe. Present the pros and cons of proposed management in a balanced way. See, this is actually communication task. We cannot tell in detail about laparoscopy, tube test, HSG, but you can just recommend that this is a safer option as it will avoid the risk of surgery. This 1, 2 sentences you can mention here. Recognize the limits of their clinical abilities and refer appropriately. Highlights all clinical governance. Okay, so all governance issue and necessary actions to reduce the risk of mishap in future. That is missing case details. Okay, that is patient safety. Does not discuss semen analysis result with the patient without the express consent of the husband. Identify any allergy. Demonstrate safe and assert accurate prescribing technique. Okay. Applied clinical knowledge. Appreciate how the diagnosis of anovulatory infertility is made based on family history, not based on family history. Okay, it will be only on the personal history. History and investigation result. Demonstrate sound and comprehensive evidence-based clinical knowledge. Interpret, explain the clinical findings accurately. Justify investigation management options. Demonstrate a rationale for each. Synthesize a comprehensive and well-organized management plan based on history and investigation, taking into consideration of the various factors. Appropriate fertility focused history, specific information relevant to possible cause of fertility. So tubal factor you missed out. Okay, correctly interprets, explain clearly investigation results of their implications. Offer additional investigation, tubal patency test, and explain why this is needed. Reassure patient that the management will not be necessarily delayed. Okay, so this reassurance is needed. Okay, explain now communication with patient and families. Possible reason for failure to conceive, which you explain. Explore fears and concerns, express empathy in the situation, patient's bitter disappointment at the need for further investigation, explain rationale for recommending treatment option, convey suggested management plan and offers hope. Recommend weight loss following ovulation induction, followed by ovulation induction, HSG or laparoscopy if patent tubes are shown. IVF may be the option as the last alternative. Estimated cost is something something. Okay. Uh, Less for a subsequent cycle if embryo frozen. Entitled to one IVF cycle on the NHS. Not entitled to one. They are generally entitled for 3 cycles.
She's 30
Yeah.
years.
Encourage and
She's 30
welcomes.
years.
So we do not need to say all those things, even do not go in the details of funding. If the criteria is met, then you are eligible for funding. You can just say that. And here you know that smoking is one of the criteria. So you can just tell her that having a healthy BMI and smoke, no addiction, Okay, so they will be seeing that. Encourage and welcomes a partner to attend the consultation in the future. So that is the last point. Okay. Overall, it was very wonderful task. I will be giving you clear pass, but you need to manage your time. If you could have done
Yeah,
it
ma'am.
within
Actually,
12
I
minutes
have
time.
little confusion. I actually also need to read it again. Like when you go for a PCOS criteria, one is the ultrasound, second is some menstrual irregularities, third one is the clinical or the biochemical evidence.
Biochemical. So there wasn't
Okay.
any biochemical evidence also, and no clinical evidence also. Yeah.
Mm-hmm.
So the knowledge is appropriate. I don't have any issue with the knowledge because you identified even you on prolactin also. You need to say that repeat prolactin after 4 to 6 weeks. You can say 4 weeks, 6 weeks when you wanted to repeat. Okay, and if it is persistently high, then we may have to involve the endocrinologist, and treatment will be started. Or even means not necessary endocrinologist. A gynecologist can also start a hyperprolactinemia treatment. Okay, very high, then endocrinologist. Okay. So, any question? Shall I end it? End this task?
Thank you so much, ma'am, for giving us the opportunity.
To
Thank
dear.
you.
Okay.